Good evening. It's Dr. Noel Williams, Optimal Health Associates, Oklahoma City, Oklahoma, March 29th, 2020. I'm going to do my COVID-19 update today or tonight. At the end, I'm going to go over some medication things. I've gotten a lot of questions about things I've gone over many times already. So at the very end, for those of you who have listened to me a bunch of times and don't want to hear me go over zinc, melatonin, Plaquenil, why or why not, why you should or shouldn't take ibuprofen, and things like that. We're going to do that at the end. So for people who do want to learn about that, it will be at the end, not at the beginning, because it's in a whole bunch of my notes already that I've posted, but I will re-review it. So the update for today is we have about 145,000 cases of COVID-19 in the country. I think we're at about 3,800 deaths, if I have that right. I may be off slightly on that because I've looked at so many numbers in the last few hours, it's starting to blend. We may be at 3,000, sorry. Worldwide, we have 720,000 cases and about 32 to 34,000 deaths now. So COVID is exploding. As we all know, just not everyone wants to realize it. I think coming from the White House over the last 2 days, there was some very important messaging, even though the message was disjointed and a little bit, I think disjointed is the best way to put it, that maybe they were going to quarantine New York, New Jersey, and Connecticut, and then they backed off that. And then you look at places like Rhode Island where they're going to pull over people with New York plates to make sure they're not coming there to stay because they need to be in quarantine for 14 days in that governor's opinion. What does this all mean? What it means is the pandemic is out of control. That's what it means. The only reason the White House would have thought to quarantine those states is that aha moment of, oh my goodness, it is out of control. That's why the Rhode Island governor wants to pull over everyone and break their civil rights because you can't pull people over just because they have a New York license plate, but they decided they should be able to help prevent transmission. That isn't going to prevent transmission. The only thing that's going to prevent or slow the wave of transmission is by a formal order to shelter in place. If you looked at my earlier post I put on about an hour ago, there's a few quote-unquote slides. One of them is of the United States. If you look at it, it's very clear that the preponderance of the cases are East Coast and they're spreading west. And if you look at the West Coast, it's pretty stable and there's not a huge concentration of cases. Why is that when they had pretty similar numbers or reasonably similar numbers 2 weeks ago or so? It's because Gavin Newsom and the governor of Washington, who's governor of California, and the governor of Washington, Governor Inslee, if I'm saying his name right, put in pretty restrictive movement orders or shelter-in-place orders. I have a brother who lives outside of San Francisco, and they've basically been at home for 2 full weeks, excluding 2 visits to the grocery store so far. But my sister-in-law, being very careful, of course, wore a mask and gloves and goggles because she's an organized person and doesn't want to bring that home to her family. So California has not had this massive uptick in cases. They're eventually going to have more cases, but they are doing the thing, and Washington has done the thing so far that has really helped. They've blunted the wave. If you look on the East Coast, it has failed. They did not take strong enough action. Now, I'm not criticizing anyone, I'm just pointing this out. I think the governor of New York has done an amazing job, but trying to deal with New York City would be so hard for anyone, and they've tried to do everything they can. But it is an uncontrolled pandemic in the Northeast corridor now, and pretty much along the entire eastern seaboard. And I think Florida will be exploding with cases in the next 2 weeks. And then, of course, Louisiana. And if you kind of look from Chicago down to New Orleans on the Mississippi Delta, the case concentration is skyrocketing there too, and it's moving further and further west into Dallas and starting to get into Oklahoma, where I am. The only reason Oklahoma doesn't have 2,000 or 3,000 cases or 4,000 cases is because we have no testing still. The governor had mentioned about a week ago or so, or 2 weeks ago now, it blends, that we'd be doing 10,000 cases within a week. we're still not doing practically any testing. In order to get a test here, you either have to be a healthcare provider, over 65, or have significant morbidities or heart conditions or something, and still have prior documentation of a formal exposure to an already infected patient, which is really hard since we have so few documented infected patients. So we're not getting any testing done here. We're hoping that that's going to change this next week, but we've been hoping that for a month, so we'll have to see. It's just a matter of not having reagents to go with the test kits and not having enough test kits. Plus, we don't have any really point-of-care testing still in the state of really any volume where you can get the test back in 3 to 4 hours is still very challenging here. I would satirically say, unless you're a celebrity or an athlete or a politician, they seem to get theirs very quickly, but us normal people don't, which still drives me a little bit nutty. So one of the things I've noticed too in Oklahoma and a lot of places is there's still tremendous denial. The number one thing I think all of my physician friends would ask each and every one of you is shelter in place, shelter in place, shelter in place. If you look at southern Oklahoma specifically, they're not following those directives because they haven't been really proposed as much by our government as they probably should have been. And so there's still people gathering at restaurants, bars, and music halls is what I've been told. People from Texas are still coming up. There still is a lot of group activities going on down there, and that's not helpful for the state. It's going to really bounce back in a negative way. We now have 16 deaths and 440 cases, like I said. It's going to skyrocket as we get more testing, and there's going to be more and more sick people. So it's really important you listen to me. Now, one of the things I want to talk about is a syllogism. Syllogisms are an interesting philosophical argument or way of putting things. And the way they work is you take two premises to draw a conclusion. And so what happens if I said all dogs are animals, and then all animals have 4 legs, the conclusion I could say is all dogs have 4 legs. And that would be what we call a syllogistic fallacy. And so you have to remember when people give that argument that, because this is one of the things that people in denial do that I've heard so many times, and I try to grin and bear it and not say anything, but it's getting tiresome. Well, we're really concerned about, we've let 1 million people die of flu in this world. Why should we care about this? Or we've let 1 million people get killed in car accidents a year in the world, and why should we care about this? Well, the problem with all of that is they're making some logical mistakes. And the first one's called an illicit affirmative statement, meaning you're tying a positive statement or a true fact, 1 million people die of car accidents in the world a year, or 1 million people die of flu in a year in the world, and you're tying it to a false conclusion, which is, and we don't care about that. Yes, we do care about that. But then they emphasize it, and when you emphasize something that strongly, you're making a model scope error. And all that means is, you know you're wrong, but you make it sound like you're really right. But model scope errors are just a further error in thinking. And so that's what these people are doing. And if you actually look at, let's talk about car accidents. What was in the United States in 1972, 54,000 people were killed in car accidents. That was 26 per 100,000 in the population. Well, if you look over that time, and some of it came from, the oil crisis and other things, we lowered the speed limit. The federal government got involved and insisted on federal safety guidelines. And so what's the actual rate of car accident death now in the United States? It's 11.6 per 100,000. It's way, way lower. And so we've spent billions and billions and billions and billions of dollars and made a huge effort to lower car accident deaths. If you look at the flu, some of the peak years of flu death rates were 18 per 100,000. We're now, for the last decade, have been running 5 or 6 per 100,000. So again, we've spent billions of dollars. People really do care about it. And so when you start trying to diminish COVID-19 by saying, we don't care about this other bad stuff. We actually do care about this other bad stuff. So stop saying we don't care. We do care. We've done a lot to try to change disease events in this country and in the world. Governments have, doctors have, healthcare givers have. I mean, so we have to start looking at people and being able to go, that doesn't follow. It doesn't follow. And because if you don't get it with COVID-19, you or one of your loved ones, because you've caused transmission, could be infected and could be one of the people who pass. And we don't want that to happen to anyone. So my message for tonight is shelter in place. Follow the guidelines of the California governor and the Washington governor before it gets out of control. I mean, Governor Cuomo has also done that, but now it's a little too late in New York. So we really want to focus on shelter in place. Do not go out if you don't need to. If you don't need to go to the grocery store, don't go to the grocery store. If you're bored at home, figure out something else besides going out. That's the things you need to do. And that's my main take-home message today. Oklahoma is in really good shape. The hospitals are geared up, they're ready. The medical staffs are getting a little, I would say not rest right now, but their stress levels are a little lower. And because they've had a decrease in their overall admission or number of patients in the hospital as they're getting ready for the COVID patient deluge, which is picking up in all the hospitals in our community. But I can say I'm very proud to be a member of our community and our medical community because there's so many wonderful doctors, of course, David Chansom, who I'm always raving about, and many other physicians and administrators who are really have helped the state get ready. David Holt, the Oklahoma City mayor, has definitely been fantastic. A big shout out to him with the shelter in place order that was formal. I can't emphasize enough that this is a crisis. This is his first year in office, and he's really stepped up to the plate and helped the state a lot. So now I'm going to talk about just things we do to help prevent or retard the effects of COVID-19. So the first thing I've talked about now since February 9th, 2020, is zinc. Zinc 50 milligrams a day is a very standard dose for raising your alpha interferon, which is your primary mediator to fight viruses. So when you have higher alpha interferon, you have more viral immunity and you can fight the virus off before it really gets infected. The second thing is zinc is inhibitory to the original SARS virus. There's very good papers on that. And again, I've posted all this stuff and the references to what I have said before earlier, so you can look back and see that. But it's very inhibitory to the virus. And it's not because of any other reason that zinc is super inhibitory to all RNA viruses. And the reason for this is, in a simplistic manner, is RNA viruses contain things called zinc finger proteins. So in the virus, there's a protein that looks like this finger. And there's a protein molecule going this way and a protein molecule going that way. And then right at the top is a zinc molecule. And the simplistic thing is, when you have a lot of zinc in your system or in your tissue as the viral particle comes in, your zinc kind of knocks the zinc in the viral particle off and the protein straightens, so it's hard for the virus then to replicate. So it's very inhibitory. So then the dosage we use if someone has any symptoms of flu, cough, congestion, or even allergy right now is you go from 50 milligrams once a day with food, is you take 50 milligrams an hour for 4 doses to hit 200 milligrams over 4 hours, but you got to eat a lot or you're going to get sick. You then take 2 to 3 days off the zinc. That pulse of zinc, though, will be really inhibitory to any viral proliferation that you may be getting from any kind of cold or flu virus. And so it's a great way of knocking down potentially COVID-19. Number 2, we talk about melatonin now. It's just a milligram a day. If you take more, it's fine. But what happens is melatonin turns out to be inhibitory to this peptide or protein called interleukin, and there's a whole bunch of interleukins. Interleukins are inflammatory messengers, and the thing that's happening with COVID-19 is that one of the interleukins turns on and it causes people to get really inflamed in their lungs and then their whole bodies. And that interleukin is blocked by melatonin. This data came from looking at what do kids have that makes them not get as sick as adults, and it turns out since their human growth hormones are higher, their melatonin's higher, and the melatonin helps block that interleukin effect. So that's the second thing to be on. Thirdly, always a good multivitamin. A multivitamin, especially a high quality one, raises your T4 helper cells over the course of 8 weeks. T4 helper cells are the lymphocyte or white blood cell that fights viruses, so having more of them would be helpful right now in particular. The fourth thing that we can talk about is ibuprofen. So ibuprofen use currently is safe. If you would normally take ibuprofen for a headache, it's fine. What we're worried about though currently is that the angiotensin converting enzyme 2 receptor, which is what the virus binds to, can be upregulated because of Motrin or ibuprofen. So using it when you're infected could be harmful. Again, I want to emphasize the current recommendations are don't have people start ibuprofen. But since it's a consideration and we don't have really any particularly good therapies that are FDA approved, I think doing everything you can to avoid stimulating a greater viral event makes sense by avoiding ibuprofen as much as you can, but absolutely positively if you get sick. Then just use Tylenol or NyQuil or anything that doesn't have Advil in it, or that's a branded product, but ibuprofen. And we're generally encouraging people to stay away from anti-inflammatories in general. There's other disease models where anti-inflammatories made things worse, so this is not that big of a surprise. The last thing we want to talk about is Plaquenil. In order to take Plaquenil, a physician has to prescribe it to you. And to be clear, I can't prescribe it to you. And you have to have been in my practice, I have to have seen you, and I have to have a reason to give it to you. But the Plaquenil data for COVID-19 is actually pretty good. I mean, none of the data we're not going to have a study of 500 patients right now in a placebo arm and an active arm that get it acutely and have that data to show to people right now. I mean, we're in the midst of a battle against this virus, but there's data from China that's very good that showed that Plaquenil was inhibitory to the virus, and it was also prophylactic in tissue. Not that we want people to be on it prophylactically, but if you get COVID-19, Plaquenil is showing very, very positive preliminary results against the virus, which is why it's become first-line therapy in China. Now, the Chinese data has been absolutely terrible. It's basically meaningless in terms of any of their numbers of patients they've had, but some of the treatment data is really good. And so they're using Plaquenil as a first line, and as President Trump said today, there's an 1,100 patient study going on in New York right now to see outcome. The key thing with Plaquenil is you have to start it earlier than later. If someone's already critically ill, I think the expectation of Plaquenil helping is going to be lower than if we are catching them when you're just sick or getting a little more sick. If you've already gotten super sick, a whole cascade of events can occur irrespective of the COVID, just because your body gets so inflamed. So Plaquenil would be a reasonable thing for people to consider and discuss with their doctors. Now, the thing about Plaquenil is very safe. I've prescribed it a ton of times over the years to get arthritis patients started before they could get in with rheumatologists, and we had great documentation of that they had RA or lupus or something already. And back in the day, a few years ago, it would take 3, 6, 9 months to get in with a rheumatologist here in Oklahoma City. So I'd start treating them. Plus I have hundreds and hundreds and hundreds of patients that are managed by rheumatologists and are on Plaquenil. So the tolerability of Plaquenil is very good. Long-term use, there's a few things you have to follow. You have to do liver function tests and look at their kidney function, and you have to follow their eyes with eye exams every 6 months. That's for long-term use. In a otherwise healthy patient, Plaquenil is very safe to take for 5 days. But again, it has to be through your physician. A physician has to do it for you. But I don't think there's any real problems with prescribing Plaquenil. If you go to Egypt or you go to Africa, they don't do a whole bunch of testing to put you on Plaquenil, which is hydroxychloroquine or chloroquine, as a 2-week course for malaria prophylaxis. That is not what has been done in this country for the last 40 or 50 years. You just get the 2 weeks of the medicine and you're off. So a 5-day course I don't think is the end of the world in any respect. But again, it needs to be through your physician, and just keep that in mind. Tomorrow night, if any of you are still listening, I'm going to do a question and answer at 8 o'clock Central Time. We'll do that live. So if you come on and start watching about 8-ish and you send questions, and we'll give directions on how to do that, I'll do my best to answer them for about an hour. Take care and good night.